My name is Nishasha binti Muhammad Shamhari. I am from class DDT 5A. My student ID number is 05DDT19F1017.
Hi, my name is Adia Rahima. I'm from DDT 5A and my registration number is 05DDT19F1122.
My name is Hani Azima binti Zainuddin. I am from semester 5, class DDT 5A, and my registration number is 05DDT19F1042. We are going to present to you our final year project called Myhealth application. For the introduction, COVID-19 pandemic spread has impacted the world in a critical way in the present situation. To reduce its effect, the only viable solution is to mitigate steps in the spread and curb the disease. To restrict and control the disease, the best way is to monitor the potential infected patient, which is called PIP, in quarantine by enforcing the predestined location during the period. People can monitor and predict the incidence of COVID-19 using device or application such as heart rate, temperature, oxygen saturation, and other respiratory system. The key to combating the COVID-19 is to diagnose it early to prevent spreading the virus widely. This will substantially help healthcare providers to arrange better treatment plans, save more lives, and reduce contamination infections. The first step in the early diagnosis of COVID-19 is to understanding its symptoms. According to the CDC, as of September 2020, COVID-19 has a wide range of symptoms, including fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscles or body ache, headache, the new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Among them, fever or high body temperature is one of the most common symptoms of COVID-19 when the measured temperature exceeds 38 degrees Celsius or 100.4 Fahrenheit. We propose an Android-based mobile application that monitor users' health. The personal health monitoring is considered very important because the rise in health problem. Through the use of some features from the application on their device, users may remotely check their health from their homes, and self-isolation or self-quarantine users can keep track of their daily health symptoms. It is based on monitoring the oxygen level, heart rate, and the body mass index of the user.
For the problem statements, since some people rarely check their health, they are unaware of their current state of health, and that can cause infection like COVID-19 to spread uncontrollably, especially in this time of pandemic, where taking care of health is something very important. Frequent hospital visits are discouraged due to the outbreak of the new coronavirus COVID-19 disease, as most people are affected by patient or healthcare members, whether doctor or nurses. As a result, there is a pressing need to go forward with remote healthcare. particularly in the case of highly infectious viruses like COVID-19 in order to protect life. For example, develop self-monitor application during COVID-19 might be useful for encourage people to monitor themselves. For project scope, firstly we have user scope. This application focuses on public citizens residing in Malaysia. Next, system scope, which are this application should be able to record daily user heart rate and oxygen rate. This application should be able to display user health status. This application should be able to be monitored through mobile devices that connected with the internet. Last but not least, this application can calculate body mass index of the user.
We have three objectives for our project. So the objective of our project are to develop smart health application that helps user monitor their own health. Secondly is to record user oxygen rate, heart rate, and BMI via email. And lastly is to display user health status.
When we open our app, this is the main page for our app. Firstly, we have the user guide button where it is for oxygen rate and heart rate. User can read it so they can understand how to use it. Next, we have the oxygen rate button. In oxygen rate button has the user guide button, also have the instruction inside of it. So we place our hand at the back of the camera and wait it for 15 seconds. And when 15 seconds is done, it will show your oxygen rate result. Click oxygen rate chart, it will show the table of the oxygen rate chart. User can share their result by clicking share button, then send it to the Gmail to record their oxygen rate data.
Next is for heart rate function. You can click this heart rate button. Then before you start, click user guide button to read the instruction. Then place your index finger for 15 seconds to get the accurate result and wait for 15 seconds. When the result is out, you can click this heart rate chart to see the maximum and target heart rate chart. Then you can click this share button and share it via email to record your heart rate reading.
For the third function is BMI. You will enter your weight and height manually. For example, your weight is 50 kg and your height is 150 cm, and click on calculate button. After that, it will show your result. Click on BMI table to see your BMI in what category. For the fourth function is COVID updates, which is you will be provided by links. For the first link is COVID-19. This is to see data and insight of COVID-19. For the second link is SDMC, to see update of cases in Sarawak. For the third link is outbreak, to show your live updates of COVID-19 outbreak.